it's interesting to hear this. As doctors, we probably do use terms that maybe are a bit unclear sometimes for people. But if we say a mole looks sinister, we are saying that we are worried that it might be cancerous. It doesn't mean that it is cancerous, but that's the thing that you're looking for in a mole, basically. When you're looking at a mole from a medical point of view, you're saying, is it cancer or is it not cancer? Because if it's not cancer, it's like, slightly academic what it is, although there's lots of different kind of names for different types of moles. But the main thing that we need to exclude is cancer. So if someone says it's suspicious or worrying features or things like that, then we are concerned that it might be cancer. That's what we mean by the word suspicious or sinister. It doesn't mean it is cancerous. So just because your doctor's told you your mole is sinister or suspicious, it doesn't mean it is cancerous, but it means that it needs to be, well, at least looked at and kept an eye on. And really the best way to tell whether a mole is cancerous is to remove it and send it off for analysis under a microscope. And sometimes you see ones that, as a doctor, you're pretty comfortable that it is cancerous, and they come back and they're not cancerous. So, just because we think that they are cancerous doesn't 100% mean that they are, because we need to get them sent off. And the flip side is also true. I'm sorry to say, you do sometimes get some that you weren't that worried about that turn out to be cancerous. So it just means it needs to be looked at and potentially removed if the doctor said it's sinister. That's what the word sinister means when you are concerned about a cancer. And to be honest with you, in terms of cancer diagnosis, what you really need in any cancer, doesn't matter what it is a tissue diagnosis. So you need a piece of the tissue. So even if you have something that looks bad, whether that be a mole that looks bad, or if you're doing an endoscopy and you're seeing a piece of your stomach or the lining of your stomach or your bowel, if you're looking at various bits and bobs, you have a scan and something looks bad, what we really need is, we can often say, crumbs, that looks bad, but we need a tissue diagnosis. We need to send that tissue away so they look at it under a microscope, and that's the sort of definitive way of diagnosing a cancer. So if your mole is not in a particularly cosmetically sensitive area and there are concerns about it, it is worth, first of all, getting it looked at. And if it's sinister or got some worrying features or changing, then it's worth getting it removed and looked at under a microscope, because then you know for sure whether it was a cancer or not. So yes, that's the sinister word sorted out. How long does a typical mole or cyst removal take? Half an hour, I guess, a typical one. Obviously you get large moles and large cysts, and you get cysts which have previously been removed in the past or previously been infected, which can be more difficult to remove. So sometimes they can be difficult to remove and take longer, but I would say half an hour would be a kind of ballpark figure for removing these lesions. But it would not be unusual to take maybe an hour on one that's quite large, quite stuck down. But yeah, half an hour I would say is typical. That's just purely the procedure. You'll be in the clinic for probably an hour and a half, just bits and bobs on either side. Do lipomas always need to be removed, or can they be left alone? Yeah, they can be left alone. They don't always need to be removed. They can be left alone. That's absolutely fine. So if they're not causing you any bother, that's why when people say, can I send you a photo? Oh, you can't really see it in a photo, which is quite often the case with lipomas, to be honest with you, because they're kind of often deep underneath the skin. But if they're not causing any bother, they don't have to be removed. And obviously removing them is going to give you a scar. So, don't just leave them alone if they're not causing you bother. We always have to make sure that the lump is a lipoma. But once you know the lump's a lipoma, if you had a scan or whatever, then you don't have to remove them if they're not causing issues. What is it? There we go. Let's do this. How long for a tummy tuck, please? How long to do the surgery? It takes 3 hours, a bit like my half-hour thing. It takes 3 hours to do a tummy tuck, give or take. Someone who's quite slim, who hasn't got a large excess, 2.5 hours, 2 hours, 2.5 hours. Someone's got a lot of excess, especially if you're doing liposuction, that will probably add an hour on if you're doing liposuction. But I guess 2.5, 3.5 hours is kind of normal for a tummy tuck. Thank you. Live question. Like it. Saying hi to this person here. Who am I saying hi to? Kathy. I'm saying hi to you, Kathy. Hi, Kathy. Can you match a scar to natural skin lines or folds after having a lesion removed? Can you match a scar? What? Match a scar to natural line after having a lesion removed? Well, you normally plan the scar before you remove the lesion. And yes, you plan it to natural lines or folds. So when we're placing scars, we're matching them to natural lines or folds. And if you haven't got any lines or folds, we're placing them in places where you will have a line or fold in one day, because that's the best way to have the scar placed. Can you? Maybe what you're saying, sometimes if you're not sure where the line is, if it's an ambiguous area, sometimes the middle of the forehead, you're not sure whether to go straight up or straight across. You can cut it out as a circle and just see which way it goes. It'll go slightly oblongy in one way. Is that what you mean? After having a lesion removed, maybe? But usually that's not. Usually you kind of know which line you want it to run in, so you will draw it in an ellipse in the line you want it to be in. So you cut out the lesion in an ellipse, and the line sits in the fold or the crease that you want it to run in. So I'm not sure what that means. Can you match a scar to natural line? Not sure if I've fully understood that one. What's going on here? How long for it? I've done that one. You weigh. Sorry, I missed the answer. What? E squared, what are you playing at? You missed the answer. What about the tummy tuck? Where's you been? I answered it straight away. 3 hours, E squared. 3 hours for a tummy tuck, yeah? 2.5 to 3.5, give or take, but 3 hours. Thanks. Yeah, you're welcome. Yeah, thank you. And also said thank you for asking the question. But you did ask the question and then left immediately. But still, I'm still very grateful to you. But you came back, so come on. What we got? Do you offer same-day removal? Yeah, so we offer same-day removal not for tummy tucks, but for minor procedures, mole, cysts, lumps, bumps, inverted nipples, areola reductions, tattoo removals, minor procedures. We do a same-day procedure, which is something I'm trying to sort of roll out. I'm trying to get appointments within 7 days is one of my things. I'm trying to get enough appointments so we can offer a sort of timely appointment. That's particularly relevant for people who've got potential skin cancers. I think they often want them done not unreasonably quickly. So we're trying to give sort of appointments with short notice, no particular need for GP referral. We always write to GP afterwards, but same-day removal is one of the sort of selling points. Is that a bit salesy to say that, but one of the sort of things about the clinic I'm trying to promote. I've had a cyst removed before, but it returned. Why does that happen? Well, probably because some of the cyst wall was left. So when you take a cyst out, you hope that you get all of the cyst wall out as a nice kind of ball. And if you get all of the cyst wall out, it's not going to come back. That's why you need to have a scar about the size of the cyst. So because you need to get all of the wall out. However, if for whatever reason, when you're getting it out, it breaks apart, or you or it's been previously infected and it's all it's a bit mushy. Sometimes it's quite hard to get it out as a nice kind of ball, and so you think, hold on, I might have left a bit of the wall behind. So in those circumstances, it might come back. So if we haven't removed all of the cyst wall, it might come back. And if that happens, I normally say people won't charge if it comes back. When you do the surgery, you can always get an idea. Look, if you can sort of see the ball, then that's great. But if you just see bits of like stuff, which is basically bits of the wall that we tried to remove because it's all mushy or it's not come out nicely, then that's when you think, I hope I've got it all out. You obviously always plan to get it all out. That's always the goal. But sometimes then if you don't get it all out, it can't come back again. So sometimes it's hard to be sure if you haven't got a nice ball out. How do you ensure lipomas are fully removed? Good question. Surprisingly good question, this from a patient. That's a good question. And you kind of might think it's obvious, and sometimes it is obvious. Sometimes you do it and there's a lipoma and there's a lesion and it comes out nicely and you're kind of pretty sure you got it all removed. But often you find that they're in little bits and there's sort of fingers out to the side and bits and bobs, and they don't come out. Sometimes they pop out really well, and especially the small ones. But bigger ones often don't kind of pop out. You have to kind of cut them out. You have to look for a plane. And usually there's a pretty good plane, but you could potentially go into the lipoma. And if you're cutting into the lipoma, could you potentially leave a bit behind? And, could you potentially have left a bit of a finger somewhere? Yes, you could. And yes, I have. I'll be full disclosurely honest with you. I had a lady with one on the back, and I had to go back and remove the rest because 6 months later there was kind of still a bump there. It was a big one, mind. Well, maybe not that big, but it was that big. Well, maybe that big. Exaggerating on the camera. It was big though. That is big for a lipoma on the back under local anaesthetic. So in answer to the question, how do you ensure? Well, you just look and you try and stay on the lipoma and try and stay in the plane so that you get all those fingers coming out, but you're grabbing it with your forceps, and sometimes when you grab it with the forceps, it breaks a bit, and so then it's more difficult to sort of, once it starts breaking up, you're like, God, it's breaking up now. You've got to try and keep it in one piece. So that's, I guess, for me anyway, the main way that I try and get it all out completely is I try and keep on it and try and keep it intact. But there's always a balance because you're trying to pull it, counter traction, where you try to pull it out with the forceps and you're either using a knife or scissors to cut it out, and you want that good bit of counter traction, but not too much that it breaks apart. And sometimes it does break apart, and sometimes it's difficult to know whether you got it all out, especially a big one on the back, on the neck, places like this when it's quite stuck in and you have to cut them out. But the answer is we look to make sure we fully removed it, and without being too sort of like gory or whatever, you just sort of put your finger in and try and make sure the pocket is clear and you can't really, outside and inside, make sure you can't feel any more lumps. So usually, obviously, have got a pretty good idea that you've removed it all, but it is not unheard of to miss a bit. Let me put it like that. It's not common, but it's not unheard of. And so I normally say, look, it does swell up afterwards. So don't think, oh my God, he's missed a bit, because it will swell. You've got to leave it a few months. And if in a few months' time, so at least 3 months really, if there's a lump there, no problem. We'll go back and just remove that lump. But usually the lumps are swelling, which usually goes down. Say hi to Nayar. So we do it visually and I guess manually, I guess you'd say, how we make sure we remove all lipoma. So yeah, that's my Q&A. So I did say on the WhatsApp that you could come back at me about the sinister thing and the mole if you're out there. By all means do, but if you're not out there, that's fine. That's fine. Maybe I didn't answer it enough on the WhatsApp. I did say about what sinister meant, so anyone else can come back at me if they want. But if not, if you've got better things to do, I do not blame you. I will see no reason that I won't be here next week. I've got a flash goal. Lena, hi. What's a flash goal? Okay, so hasta la vista. Have a lovely evening.